Welcome back to the Back Pain Solutions podcast with me with Ben James, and as always, my co-host Jacob Steyn. Afternoon, Jacob.
Afternoon, Ben.
So today we're just doing a quick episode. We've got a list of questions which is very much focused around specific exercises for an L5 disc herniation, sometimes referred to as a slip disc or a bulging disc. But specifically, the question is focused on the L5 disc. Should there be anything specifically they should be doing from an exercise rehab point of view that is contrary to other things that we will have discussed before with respect to disc health and lower back pain, lower back rehabilitation? So we just thought we'd jump on, answer that question, do a quick episode today. And as always, if you've got any questions that you want to submit or get some more input on specifically, feel free to drop us an email at info@smartstrong.co.uk. Happy to pick those up and answer directly. And sometimes they can become relevant and useful episodes content for a wider audience. So Jacob, initial thoughts when you saw that question there. Do you kind of subcategorize patients with respect to disc herniations and change that approach? Or is the message actually a lot of what we said previously with respect to disc hygiene, disc health, managing bulges, herniations is pretty much the same?
Yeah, I don't specifically do something different for an L5 S1 disc or the last disc in the spine. I would look more at categories, and I'd break it down as a lower low back, so lower lumbar, so lower
Yeah,
low back um, area, and then maybe higher a higher part of the low back, so maybe TL hinge or the
yeah.
end of the rib cage, beginning of the lower back. So there could be different things going on at the upper part that we usually or never see at the lower part. I don't know. What about you, Ben?
Yeah, sure. Similar. I would argue that I'm less interested in kind of really where's that disc herniation. Is it L4-5? Is it L5 S1? I think it's fair to say when we see a lot of low back issues, the common area is the L4, L5, L5, S1. Is the approach whether it's one of those discs specifically or whether it's both going to be significantly different? And my argument would always be, well, actually it isn't. I think if we
Yeah,
if we take that same approach of let's look at the daily spine hygiene and create an outline plan for you to take away from this session today, whether that's in person or online as we're doing increasingly, then that's a starting point. These are the things that you could do for a disc in general, and based on what we're finding from you as an individual, this makes sense. Let's look at those fundamental movement patterns that support that daily spine hygiene. Let's look at an exercise plan that supports that. And actually then, if we're not seeing the responses and the results that we expect, then maybe we can start to delve a little bit deeper if we need to. But I certainly wouldn't say that I've ever prescribed exercises or a rehab plan, treatment plan that is different based on my suspicions of it being L4, L5, or L5S1.
yeah,
Possibly, like you indicate, if it is a little bit higher and we're looking at that transitional zone between the thoracic spine and the lumbar spine, and that hinge area, if you like, where we often see patients can have some issues, then that's a little bit different. But largely, if it's a relatively obvious disc bulge, I'm not specifically worried about the level, if that makes sense.
yeah,
So I would argue that a lot of the information that we would have covered before that is on the website, that is on the ebook, is relevant to a low back in general, particularly with respect to disc health and disc hygiene.
yeah. So I want to add to that. Just speaking not only of the last disc in the spine, but speaking of a lower back issue. One of the main things that you have to take away, knowing that it's a disc, and therefore knowing that it's recovering very slowly because it doesn't get blood specifically. It's finding its nutrition through hydration. It's a very slow process of healing. What I see with a lot of people is they'd be following the stuff that we've mentioned before in the past, like doing the exercises, doing the spinal hygiene, moving in the correct way. But one of the things I've noticed and realized lately is that people don't take those regular breaks throughout the day.
Yeah.
And that regular break is not specifically taking a break from what you're doing, but it's giving that disc a break,
Sure.
right? So
Yeah.
and when we say giving the disc a break, we're talking about taking the pressure off.
Yeah. Yeah.
And that's something that we're going to be covering more in later episodes. And so we're going to talk about the intrinsics of how, because there's many different ways you can take the pressure off a disc, but you have to understand which things you are able to do throughout the day to make sure that the pressure in that disc doesn't keep stacking up throughout the day, which ends up causing another reaction and throwing you back.
Yeah.
Right, Ben?
And it's a big challenge I find with patients because, oh, I got busy. Oh, it's difficult. It's challenging. And that's where, I would argue the coaching element of what we do becomes even more important versus just the clinician. It's that challenging the individual that, look, you know, this is just so fundamentally important if you want to resolve this issue. This isn't something I can just adjust, manipulate back into place. That's not a thing when it comes to discs and disc rehabilitation. It is the simple things, what seem quite boring sometimes, done consistently, that make the result in the long term and give you the outcome that you want. And
Yeah,
sometimes that's difficult, and that's difficult in terms of commitment, it's difficult in terms of time, and it's difficult in terms of managing your day. But fundamentally, we're not designed to sit in chairs all day, and you need to get that into the mindset that I'm not designed to sit here all day. So
yeah,
getting up and moving every 20, 30 minutes is fundamentally important for my back health as it stands now, and for any back over the long term, I would argue anyway. And
yeah,
so you have to recognize that what you're doing isn't the norm. And so we have to find a way to break that cycle to give the discs the break they need. And
yeah. And we're giving it the break it needs is really what we want to do is create healing capacity.
exactly.
And that healing capacity, when you understand that it's not a muscle that's full of blood, circulating oxygen and nutrients and able to recover very fast. It actually takes a long time. And because it takes such a long time, you need to consistently be busy with creating this healing capacity that's over a few weeks and months going to really take you into a direction of healing.
Yeah.
That's where it lies. So that's a main take-home message from me when we're talking about a disc, whether it's L5S1, the last disc, or the second, third, fourth last disc.
Yeah.
It's knowing what you have to do to create that healing capacity and be consistent with it. Like you say, Ben, you need to, I'd go as far, like what I say to my patients is, look, set reminders. You have to have reminders for doing this activity, which is going to decrease the pressure, which is going to take the pressure down, create new tolerance
Yeah.
capacity.
Yeah.
And if you're not good with that, you need to take your phone, set reminders, because, otherwise we're really just chasing our own tails. We want to get this thing moving in the right direction. You have to be very firm with yourself, set those reminders, get to it, or make sure you do it in your breaks if you
Yeah.
have normal working days, and you'll see results. Absolutely.
Yeah. One question that I wanted to ask Jacob: some patients respond quicker than others, you know, and I've had a few recently that have had a fantastic response. They're not kind of long term chronic, really bad episodic back pain, but they have had a chronic history of mild back pain, and instances where they get a little bit of oh, my back's gone again, that kind of um,
Yeah.
positioning, if you like. And they've got better really quickly by doing simple things. And they're like, wow, this is so straightforward. And then all of a sudden, they're feeling a bit better. And I had a guy the other day, I was building a bit of home furniture. I was bending through my back a bit. And I was like, oh, I can feel it again. So I'm trying to remind patients, look, this can take months. This can take months. You've got to be consistent. Keep doing it, even if you feel better. Even if you feel better, this
Yeah.
is your daily routine. These are the things you've got to do. Do you ever at the beginning, at the outset, say to a patient, you might respond quicker than others, but 3 months minimum of doing this, this, and this to give it the chance to properly recover? Or do you kind of do you
Yeah, I definitely my sort of typical way of explaining it is I use a bank account example, right? So we're below zero at the moment. Everything we do is painful. So we're working towards zero. When we get to zero, we're not going to have any pain anymore, but we don't have any reserve. We don't have any
nice?
buffer in the bank account, which means that if I have a long journey to Austria going skiing, or I have to work hard in the garden one day, or I slip and I twist my back, I have no reserve. I'm going to fall well below zero. I'm going to get injured. I'm going to have pain, and it's going to be very sensitive to whatever I do. So when I get to zero, from there, you have to build that buffer. That's going to take another little while of not having pain. So we're out of pain. We want to make sure we have that buffer. And when you get there, after some time, in order to keep that buffer, you have to maybe build down your exercises to a couple of times a week, or find different ways of making sure you're getting your core activated. But if you want to maintain and keep that buffer, you need to keep it active. You know,
Yeah,
so
yeah,
and that's what I. But obviously, then you have to deal with certain personality types and certain
of
people.
course.
They're very busy, whatever. They're going to do their thing, and they get better, and they're going to stop doing their exercises. But then you're just going to remind them again of, look, you
Sure.
want to build a buffer, and then
Yeah.
it's their choice. But then they understand that concept, and it's going to take longer than just getting out of pain.
Nice. Yeah, I think that's the take home here is, look, build the conditioning. Don't just focus on the pain. Don't be specifically worried about it being an L5 disc herniation versus an L4 or an L3. A lot of the simple things in terms of daily spine hygiene, rehabilitation plan are the same, but they have to be done consistently. And we want you to build healthy movement patterns, healthy back routines for the long term so that we can build that reserve that Jacob highlights there, and prevent these issues from reoccurring, because that's the ultimate goal, not just to get you out of pain. So I think a really interesting question, but don't be specifically concerned with the level. Just do the simple things consistently and you should see results. And as always, get onto the website, have a look at the ebook. We've got a lot of this content in there that will be absolutely applicable to many of the listeners, and you can action today. So get online, go to smartstrong.co.uk, download the ebook. Any other specific questions you've got, always feel free to reach out at info@smartstrong.co.uk, and we'll be back with another episode next week. Thanks for listening as always. Thanks, Jacob. Bye for now.
Thank you. Bye bye.